However, if the vitamin deficiency continues for years, for decades, then this repair mechanism overshoots, leading to growing deposits and the risk of heart attacks and strokes. So what is the most effective solution to control heart disease? And the most effective solution is by controlling two aspects. One, maintaining healthy, elastic blood vessel wall, and the other one is controlling, optimizing cholesterol metabolism in the liver. And the vitamin C, in synergy with other micronutrients, is the factor that controls both processes, maintaining healthy vascular wall and optimizing cholesterol level. Current conventional medicine takes care only of these aspects. Our scientific and clinical studies confirm that micronutrients are effective both in prevention or reduction of the progression of coronary heart disease at different stages. We know that micronutrients can prevent the deposition of cholesterol in the blood vessel wall, these are early stages of atherosclerosis. And we need to remember that atherosclerosis develops for decades. And we know that very young children, even teenagers, already may have cholesterol deposits. So therefore, it's never too early to start preventing this problem. We also know that micronutrients are effective in controlling more advanced stages of atherosclerosis, such as they can limit the proliferation of smooth muscle cells that build the blood vessel walls, and these cells, excessive growth of these cells will lead to formation of plaques. And also at later stages where calcium already deposits in the vascular wall, and the most advanced stage which carries the risk of heart attacks, this is where plaque ruptures and blood clot forms inside of the blood vessel, which can prevent the blood flow from prevent the flow of the blood, and the problem develops. So at every stage, it is important that specific micronutrients are provided to the body so the body can effectively deal with growing problems. Many people may can say that, you know, this is wonderful, but I have a different situation, because the heart disease is genetic, it's in my genetic, and therefore this may not apply to me. So our researchers will also looking at this aspect when the heart disease is determined at the genetic level. And this is why we did some experiments on animals that have a lack of a specific gene called ApoE, which makes them susceptible to heart disease. These mice have a very high cholesterol level in the blood. But in addition to this genetic predisposition, what our researchers did, they also add another risk factor for heart disease, which is high blood pressure. So we were doing an experiment in which we used mice which had a genetic predisposition to heart disease and very high blood pressure. We we separated these animals into two groups. One group was taking normal diet, and the other group was taking a diet that was supplemented with the mixture of specific micronutrients. And after some time, we analyzed, what happens to the arteries of these animals. And you can see the results on this slide. I don't think that you need a lot of explanation, and because the results are obvious. When you look at the artery of the animals which were kept on normal diet, you can see lots of orange color, which indicates cholesterol deposits. And they were so thick at some areas you cannot even see the wall. So these mice kept on normal diet developed very large cholesterol deposits. But look at the artery that was isolated from the animal who had a diet supplemented with micronutrients. The blood vessels are almost clear. So just one factor, which is the micronutrient supplementation, could make such a big difference in the organism that was genetically predisposed to disease and had other risk factors. Even more, we measured blood cholesterol level in these animals. And you can see that the total cholesterol level was lower by almost 32% in animals that were taking supplements. LDL, which is bad cholesterol, was lower by 65%. This is, you see the graph illustrating that. And the ratio of so-called good cholesterol to bad cholesterol, which is HDL to LDL, was higher by almost 60%. So their lipid profile also improved. In addition, we could see that the arteries of animals that were kept on a normal diet developed many hemorrhages, blood clots. And here you can see the dark areas that indicate the presence of blood clots, while you can see that artery of the animal from micronutrient supplemented group is free. And forming of clots in the arteries is very big, forms very high risk of heart attacks. So what do these results mean? They mean that micronutrients have benefits in decreasing risk of heart disease even in the presence of multiple risk factors such as genetic background and other factors, in this case high blood pressure. You may ask, these are animal studies, but what about people? And here you can see the ultra-fast CT picture of the fragment of the heart of the patient who had coronary calcified deposits in one of the arteries. And the deposits are seen as a white spot inside of this white circle. And this is how his heart looked like before taking supplements. After 1 year of specific micronutrient supplementation, the deposits completely disappeared. Without drugs, without stents, without any procedure, just with micronutrient supplementation, micronutrients that could help to repair the defective blood vessel wall. This is not a miracle, this is science. Even more, in many studies that were clinical studies, these were small pilot studies, we could observe that micronutrient supplementation can help in lowering high blood cholesterol level, lowering high blood pressure, decreasing the severity and frequency of arrhythmia, which is irregular heartbeat, also improvement in heart failure, heart insufficiency, and also micronutrients were helpful in normalizing blood sugar levels in people who had diabetes. Natural health, natural health provides answers not only to heart disease, which is #1 cause of death in Romania and in many countries, but also to cancer, which for many of you sounds like impossible.